Hello again guys, welcome to another Anatomy and Physiology screencast, and this week we're discussing the cardiovascular system problems. Now this screencast will be related directly to 10-mark essay questions, and the examiner will ask you what are the problems associated with the cardiovascular system, how can we reduce those problems, and what can we do for the future in order to remove their impact upon us as such. Essentially, when we talk about cardiovascular problems, we're talking about the heart, but we're also talking about the vascular system. So in terms of blood transport, arteries, arterioles, veins, capillaries, those sort of things. But the mainstay of the problems related to the cardiovascular system concern coronary heart disease, or CHD, as presently this is the cause of the most deaths in the Western society. CHD is more likely to occur with what we call a sedentary lifestyle, so not very active, not doing enough exercise, etc., or a poor diet where we eat lots of fatty foods or fizzy drinks. There are 4 different types of CHD, and these are arteriosclerosis, atherosclerosis, please note the different spelling, angina, and more common to you all, I'm sure, is heart attack. Arteriosclerosis, if we see from this picture, this is a picture of an artery, very zoomed up, and the circular things in the middle are blood cells moving through that artery, and you'll see there's some sort of thick, almost rock-like object lining the artery wall. Arteriosclerosis is a loss of elasticity in that artery, and essentially it's the thickening or hardening of the arteries. So as you see in that picture, those rock-like substances are where the inside of that artery wall is starting to thicken up and starting to harden up, and it allows less of the blood cells through, so it actually increases the blood pressure within that artery. By thickening and hardening those artery walls, it reduces your body's efficiency via the VCC, which we know about, to either vasodilate, so expand the arteries when there's more blood coming through, or vasoconstrict, which is reduce the amount of blood flow to the organs or to the muscles as necessary. If you look at that picture, if you imagine just where that rock-like area meets, and you see where the blood is actually going through a very, very thin point, if you try to vasoconstrict that area, it will almost clog up the artery because it's that thick, those sort of hardened areas on the inside of that wall, and can cause lots and lots of problems. Now, this is mainly caused by smoking, and smoking accelerates the hardening of these arteries by building up lots of deposits on the inside of the artery walls. Atherosclerosis is a form of arteriosclerosis and is very similar in its concept. The main difference is cholesterol and fatty deposits accumulate within the arterial walls. Alright, so as you see in the 3 pictures, the top one is a nice healthy arteriole. Remember, an arteriole is essentially a much thinner and much smaller artery, and the top picture shows very clean arteriole and blood can pass through smoothly. The middle picture shows where we've got a build-up of fatty deposits through cholesterol, which is often caused by poor diet but also by stress, and this build-up, if you look what is happening in that arteriole, is not allowing so much blood to pass through. It's a very thin area. And what essentially this does after picture 2, it starts to lead to lumen narrowing. So it's the narrowing of that artery or arteriole. And what that does then is it restricts the blood flow. It lets less blood through. And essentially that leads to 2 things as a consequence: high blood pressure, because we were just talking about your body will find it difficult to also control blood pressure in the fact that you can't vasoconstrict or vasodilate because you've got a massive clog of cholesterol in that arteriole. And the other thing it does, in the bottom picture you can see it's caused a blood clot. So as more and more fatty deposits reach the other side, so start to clog up that arteriole, it doesn't allow any blood cells through, and these blood cells start to squirm together around the fatty deposit and clot up the entire arteriole, and that is a cause of massive problems for the rest of your body. So don't be confused with the difference between the two scleroses. Angina is whereby you have a partial blockage of the coronary artery. So the coronary artery is located in the heart. As you can see by the picture, if we start to block these arteries, it means our heart can't function correctly because there's not enough oxygen being able to be transported to the heart muscle walls in order for it to pump. It causes intense chest pain if you have angina, and arteriosclerosis or atherosclerosis are the main causes of angina, but instead of being around different areas of the body, the arteriosclerosis or the atherosclerosis actually happens within the coronary arteries as shown in the picture. So you can see one of those arteries within the heart, the coronary artery, is starting to get clogged up. It reduces the opportunity for blood to pass through and provide oxygen for the muscle walls, and therefore starts to cause angina. It's only a partial blockage though, it's not a full blockage. Angina often occurs during exercise because as you exercise your heart wants to beat faster, your muscle wall in the heart needs to work, and it suddenly realises, well actually we can't get enough blood or oxygen to the muscle cell walls because of this partial blockage, and therefore heart feels incredibly tight and angina occurs. And finally the heart attack. So we've gone through in stages here, so you can probably guess how this is going to occur. And again, like angina, we're talking about blocked coronary arteries, and heart attacks are a total restriction of blood flow to a part of the heart muscle wall. So instead of a partial blockage, which was angina, we're talking about a total restriction, a total blockage. The lack of blood flow creates permanent damage. So if we look at the picture, if we have a blocked artery at the top, completely blocked, no blood can go through, and because there is no blood going through to provide oxygen for the heart cell muscle wall, that shaded area starts to become damaged, and it's damaged muscle cells that we can't get back. Despite our best efforts with modern science, we can't return muscle wall cells at the moment. So your heart muscle wall cells die. And as I mentioned, this is caused by a blockage or a blood clot to the larger coronary arteries that are involved within the heart. As per usual, make good notes, bring to the class, we'll discuss this a little bit further and play around with some ideas, and we'll also start to look at how we can reduce our chances of getting coronary heart disease.